Hello everyone. I just wanted to send you a video mail to watch out or tell you some of the mistakes that I often see students make in their Unit 3 test, and I wanted you all to keep an eye out and not make those mistakes. I have given you tips in your announcement, but here are some of the important things that you need to know. The first thing is that you must be able to identify the muscles. So, look for landmarks. For example, when you get muscles on the front of the arm and the forearm, look to see if the palm is showing, especially for the forearm. The biceps and the brachialis and the arm look very different from the triceps, so you must know that. So that's one thing. So when you know muscles in any part, for example, if you know muscles which are on the anterior aspect of the forearm and those muscles cross the wrist joint, then you should know what their actions are. So if all the muscles present here cross the wrist joint, they will have some common actions. For example, flexor carpi radialis, flexor digitorum, flexor carpi ulnaris, flexor pollicis. All of these, since they cross the wrist joint, they will flex the wrist joint. Automatically, their antagonists will be muscles which are placed on the posterior aspect. And the names are self-explanatory. For example, extensor carpi. It means that the extensor it's an extensor of the carpus or the wrist. So that's one. So when you write your answers and you are asked what is the action of a muscle, it's extremely important to say the muscle is of, this muscle causes flexion at the wrist joint, or you say it causes flexion of the hand. Say we were talking about flexor carpi ulnaris or radialis. Now if we were talking about, say, the biceps, for example, don't just say it causes flexion. You must say it causes flexion at the elbow joint, and biceps also happens to cause flexion at the shoulder joint. So that's how you're going to write that. You either say the joint or you talk about the area that is moved. In this case, we would talk about the arm, the forearm, or the hand. So that's very important. And if you look at the images, it helps you. So if you know that there is a muscle which is on the front of the neck, any muscle which is on the back of the neck will automatically be an antagonist of the muscle. So very, very important for you to know these, some of these points. I often find that identification is the place that students make mistakes. The second is you have to recall your skeletal system, the anatomy that you learned in the skeletal system. For example, you know that the shoulder is a ball and socket joint, just as the hip is. The elbow is a hinge joint. The wrist is what we call an ellipsoid joint. So it causes flexion, extension, adduction, and abduction. So, you should know some of those movements which are produced. So very important. Also make sure you read the question carefully. Sometimes it asks you what are the actions of these two muscles. So then you talk about the actions after you identify them. The other time it might ask, at which joint do these muscles act synergistically and what is that action? So then you are not expected to answer individual actions, but you have to say at which joint those muscles are synergists. Again, let's say we take the wrist joint and we are talking about flexor digitorum profundus and flexor pollicis. So they are synergists at the wrist joint because they both cause flexion, but the pollicis also happens to flex the joints of the thumb, and the digitorum flexes the joints of the finger. So they are different there, but their synergistic action is flexion at the wrist. So that's how you would answer the question. So be very careful with that. Always know your nerve supply, especially wherever it is mentioned, and take the time to read the question very, very carefully. Go over your quizzes and look at the the feedback given for some of the answers.